If your prostate is already enlarged, or if you're dealing with frequent urination at night, what does regular ejaculation actually mean for you? I'm Dr. Laura Stone. A well-known study from Harvard found that men who ejaculated more frequently, about 21 times per month or more, had a lower risk of developing prostate cancer later in life. That statistic made headlines. But here's where it gets complicated. That study looked at cancer risk, not benign prostatic hyperplasia, what we call BPH, or age-related prostate enlargement. BPH, short for benign prostatic hyperplasia, isn't cancer. And it doesn't mean something is wrong with you. In fact, it's one of the most common conditions affecting older men, especially after age 60. The prostate is a small, walnut-sized gland located just below the bladder. It wraps around the urethra, the thin tube that carries urine out of your body. As you age, this gland can slowly enlarge. Not because of disease, but because of natural hormonal changes. And while this growth isn't dangerous in itself, the location of the prostate means that even a small amount of swelling can compress the urethra, making it harder for urine to pass through easily. Some urologists have proposed that ejaculation, whether through intimacy with a partner or solo, might play a subtle role in managing those symptoms. One explanation is what's sometimes referred to as the drainage theory. When a man ejaculates, fluid from the prostate is released as part of semen. Over time, if ejaculation becomes infrequent, some doctors believe that this fluid can accumulate, becoming thickened or stagnant inside the prostate's ducts. So by ejaculating periodically, the theory goes, you're helping to clear the pipes, removing excess fluid and potentially reducing localized inflammation or internal congestion. Another possible benefit? Pelvic muscle activation. Masturbation engages the same pelvic floor muscles used during bladder emptying and sexual activity. This is why physical therapists who specialize in men's pelvic health often recommend exercises like Kegels to support both urinary and erectile function. Sexual activity, including masturbation, can offer a similar kind of engagement. There's also the matter of blood flow. Sexual arousal increases circulation in the pelvic region. That enhanced blood flow may help deliver oxygen and nutrients to local tissues, including the prostate and bladder neck, which could support healing and function over time. Then there's something even more overlooked: stress. We know that orgasm helps lower cortisol, the body's primary stress hormone. And elevated cortisol has been linked in some studies to increased inflammation, poor sleep, and even heightened urinary urgency. So it's not unreasonable to imagine that a short moment of release might ripple outward in ways that go beyond the prostate itself. By now, you've seen that masturbation may offer some indirect comfort for men with an enlarged prostate, but it's just as important to understand what it can't do. Let's begin with the study that often gets cited, the one from Harvard. This research, published in the Journal of the American Medical Association, found that men who ejaculated more frequently had a lower long-term risk of developing prostate cancer. And it certainly raised important questions about the possible links between sexual activity and prostate health. But it's crucial to clarify something. This study was focused on cancer prevention, not BPH. And even then, the findings were correlational, not causal. In other words, the researchers observed that men who ejaculated more often had lower cancer rates, but they couldn't say for sure whether ejaculation was the reason, or whether it simply reflected other health habits, like better cardiovascular fitness, lower stress, or overall well-being. There's no direct clinical evidence, not from Harvard and not from any major urological society, that masturbation reduces the size of an enlarged prostate. So while it may provide short-term relief in some cases, it is not a recognized treatment for BPH. That distinction matters. Because if you're managing urinary symptoms, relying solely on self-care routines without understanding their limitations could delay necessary medical support or overlook more serious issues that deserve evaluation. There are also specific situations where frequent ejaculation could backfire, particularly for men dealing with more complex conditions like prostatitis or chronic pelvic pain syndrome. In these cases, inflammation or hypersensitivity of the pelvic nerves can cause burning, aching, or pressure in the prostate area, especially after ejaculation. Some men describe it as a sharp discomfort that lingers for hours or even days. For these individuals, masturbation may not be soothing. In fact, it can sometimes worsen pain, trigger bladder urgency, or prolong flare-ups. That's why it's important to pay attention to how your body responds, not just in the moment, but in the hours or days afterward. Another factor to consider is the impact of certain BPH medications on sexual function. Drugs like tamsulosin, an alpha blocker, and finasteride, a 5-alpha reductase inhibitor, are commonly prescribed to reduce prostate size or relax bladder muscles. But one of their potential side effects is changes in ejaculation. Some men experience delayed ejaculation. Others notice reduced volume. And in some cases, there's retrograde ejaculation, a condition where semen flows backward into the bladder instead of out of the body. While not harmful, it can be unsettling if you're not expecting it, and it may make self-care feel less satisfying or more confusing. Lastly, there's the issue of overuse. Like anything, masturbation can become problematic when it's used too often, too aggressively, or as a primary way of coping with stress, boredom, or anxiety. This can irritate pelvic nerves and muscles, leading to increased tension or sensitivity in the area, especially if you already have BPH-related pressure or discomfort. Some men find that what started as a source of relief becomes a contributor to the very symptoms they're trying to manage. None of this is about judgment. It's about context. Masturbation is not harmful for most men, but it's also not a treatment for an enlarged prostate, and using it with that expectation can lead to frustration, confusion, or unnecessary worry. The healthiest approach is to treat it like any other part of your routine, one that you monitor, adjust, and evaluate based on how it affects your overall well-being. So, can masturbation help with an enlarged prostate? The honest answer is, it might, but in indirect ways. What masturbation can offer for some men is a bit of relief. By releasing fluid, it may reduce pressure inside the prostate ducts and ease some of the discomfort that comes from fluid buildup. It might also help activate pelvic muscles and improve blood flow, which are both beneficial to overall urinary and prostate health. Stress relief is another important piece of this puzzle. Managing stress can lower inflammation in the body and reduce urgency or frequency of urination. Because masturbation often helps relax the mind and body, it can contribute positively in this way. That said, these benefits are subtle and vary from person to person. Not every man will notice a difference, and some may find no relief at all. For others, frequent ejaculation might even increase symptoms or discomfort. This is why listening carefully to your own body is crucial. If you find that masturbation helps you feel more relaxed, eases pressure in your pelvic area, or improves your sleep, these are good signs. They suggest your body is responding well. However, if you notice any increase in pain, burning, urinary urgency, or worsening of symptoms after masturbation, that is a signal to pause and reconsider. No one should feel shame or embarrassment about their private habits, but it's important to be mindful and honest with yourself about how those habits impact your health. Avoiding masturbation out of fear or misinformation is unnecessary. It is a normal, healthy part of life, even for men in their 60s and beyond. At the same time, it's equally important not to rely solely on masturbation as a way to manage your prostate symptoms. Benign prostatic hyperplasia is a common condition, but it often requires medical evaluation and sometimes treatment to prevent symptoms from worsening or affecting your quality of life. If you experience frequent nighttime urination, difficulty starting or stopping your stream, a weak flow, or a feeling that your bladder isn't fully empty, these are signs to discuss with a healthcare professional. Visiting a urologist can help you understand the specific nature of your prostate enlargement, rule out other conditions, and explore treatment options that fit your health and lifestyle. Treatments range from lifestyle changes and medications to minimally invasive procedures, depending on the severity of symptoms. What's most important is that you don't ignore symptoms or delay seeking advice because of embarrassment or uncertainty. Your health and comfort deserve your attention. Taking that first step, asking questions, sharing your concerns, and working with a trusted doctor can bring real relief and peace of mind. So, where do you go from here? Start by paying attention to how your body responds to different habits and activities, including masturbation. If it feels helpful, keep it as part of your routine. If it causes discomfort or worsens symptoms, let your doctor know. And remember, managing an enlarged prostate is about the whole picture. Your diet, exercise, stress levels, medications, and medical care all play a role. You deserve to understand your body, to feel comfortable in your own skin, and to live well. If this video helped clarify something for you, consider subscribing for more clear, respectful answers on men's health topics that matter. And please share this video with someone who might be quietly struggling but hesitant to ask for help. Your health is worth these conversations. Lastly, always remember, all information provided in this video and channel is for educational and informational purposes only. It's not a substitute for professional medical advice. Always consult a qualified healthcare provider about your specific circumstances before making any changes to your lifestyle, diet, supplements, or medication. Taking control of your health starts with informed, compassionate guidance, and you're not alone.